Hi, welcome to Your Filthy Mouth and Lifetime Dental. It's the podcast that we do every week with Dr. Chuck Reinertson from Lifetime Dental. I'm Suzanne Lynn, and we're glad that you're joining us today. We actually had this Corona special edition kind of scheduled to do last week, but we decided, we're just going to wait a week, get a little bit more information. We want to make sure anytime we ask for your time, we know it's very valuable, that we have valuable information that we can share with you. So we are here today, Dr. Chuck.
Last week, we didn't know what to say. This week, we think we know what to say for now, but that may change by tomorrow.
Right,
So
right.
we're going to try and bring you up to date with what's happening right now.
And we know that you've got questions. Dr. Chuck is going to do his best to answer the questions that are dental related. I know that we all have tons of questions outside of the dental realm, but we'll just keep them dental related for now. But Dr. Chuck, let's talk about your office in Tavares, Florida on 441, right next to the new 7-Eleven. What is the situation as far as you being open and who you're serving?
Well, Governor DeSantis put out an order last week for all dental offices to be closed except for emergency situations. That means all dental offices. So we're included in that. Mm-hmm. So not just us, but all the dentists in the area and in the state are not going to be seeing patients other than for emergency situations.
Okay.
And so the question is, what's an emergency? And the American Dental Association actually has a sheet that constitutes what is an emergency.
So I'm guessing teeth whitening, probably not an emergency.
Probably not an emergency.
That's right. Have you seen my teeth lately? I don't know. Okay. Well, let's talk about some of the emergencies.
Well, they break down dental emergencies actually into three categories: a dental emergency, urgent dental care, and other urgent dental care. So dental emergencies are potentially life-threatening and require immediate treatment to stop ongoing tissue bleeding, alleviate severe pain or infection, and include uncontrolled bleeding, cellulitis or a diffuse soft tissue bacterial infection with intraoral or extraoral swelling that potentially compromises the patient's airway, and trauma involving facial bones, potentially compromising the patient's airway. So we're talking about just staying alive. So there are some dental things that need to be done to help people stay alive. That's one category. Then they got two more.
Okay.
Urgent dental care focuses on the management of conditions that require immediate attention to relieve severe pain and or risk of infection and to alleviate the burden on hospital emergency departments. These should be treated as minimally invasive as possible. This includes severe dental pain from pulpal inflammation, that's a toothache, pericoronitis or third molar pain, that's your wisdom teeth.
Okay.
Surgical post-operative osteitis, dry socket dressing changes. That's if you have a dry socket. Okay.
Oh, yeah.
Abscess or localized bacterial infection resulting in localized pain and swelling. Tooth fracture resulting in pain or causing soft tissue trauma. Dental trauma with avulsion or luxation. That's getting your tooth knocked out. Dental treatment required prior to critical medical procedures. Sometimes you have to have some dental work done before you can have the medical procedures. Right. Okay. Final crown and bridge cementation if the temporary restoration is lost, broken, or causing gingival irritation. So you've got a temporary crown on right now. You're waiting for the final crown. Unless there's a problem with the temporary, you're going to have to wear the temporary until we're able to get the patient in and put the final crown on.
Okay, and you were saying that you got a phone call in that situation.
Well, we called the patient to reschedule them, and they were kind of like, well, what am I going to do? Well, how is the temporary doing? Well, it's doing fine, but I don't want to keep this temporary in there for a long time. Well, we don't either.
Right. There's nothing more you want to do than get back.
Yeah. Right. So we just have to follow the rules on these things. If there's a problem, we'll certainly take care of it. If there is no problem, if it's doing fine, because I've had people with temporaries on there that say, man, that was fine. I didn't even know it was there. That's fine. We're looking for your comfort on that.
Okay.
And the last thing is for a biopsy of abnormal tissue. So if you've got something going on that's pretty questionable, yes, that can be biopsy.
Okay.
But that's not the typical things we see in every day.
So every day is going to be a child falls down and a tooth comes out. It's okay to call. That's an emergency.
That's an emergency.
And one of the things that really stands out to me is that a lot of times in these shows that we do, we talk about how the fact there is no pain with serious issues. So where do we go? How do we know whether something's serious or not? Understanding that a lot of dental issues don't have pain.
That's high blood pressure, diabetes, glaucoma, and cancer also don't have any pain. So if you're waiting for the pain, you could be waiting way too late. Now, we're not asking you to look for the pain right now. We need to keep things under control. But we're going to talk about why your home care right now is especially critical as soon as we finish out this. There's one last category. This is other urgent dental care. Extensive dental caries, that's cavities, or defective restorations causing pain. Manage that with interim restorative techniques when possible. That means just do the minimal thing that you can do in that. Suture removal, we can take out sutures.
Okay.
Denture adjustments on radiation or oncology patients. So if the person is not just a denture adjustment, but if you've got an underlying problem, you need to be able to eat your food.
Okay.
Denture adjustments or repairs when function is impeded. Okay, so if you can't chew, that's a whole different thing. You need to be able to eat. So we do denture adjustments on that. Replacing temporary filling on a root canal access opening and a patient is experiencing pain.
Okay.
So when you do a root canal, sometimes they'll put a temporary filling over the top. If that temporary filling gets knocked loose and you're having pain, then that's where you need to come in. And the last thing is snipping or adjustment of an orthodontic wire or appliance, piercing or ulcerating the oral mucosa. You got braces on, you got a wire sticking in your cheek.
Oh, that hurts.
Yeah.
Oh, hated that. I was in third grade. I can still feel it.
It's real.
Yeah, it is real.
It's real on that. So, but those are some of the conditions that are acceptable to be treated. That's the minority of things that we see. Regular fillings, they can hold off.
Okay.
Your hygiene visits or cleaning, and we're going to talk about that in just a minute, but that can hold off a little bit. Most things you can put off for a little while. That's what we're trying to do. We're not trying to eliminate it or not do it. We're trying to just delay doing it until this coronavirus is a little more under control. Again, until at least May 8th. We don't know if there's any time after that.
Okay, so putting this in understandable, relatable, everyday things that happen. Teeth come out by accident from, falling down, with, like we mentioned, with a child, having trouble breathing, severe pain. These are all emergencies.
Those are all emergencies.
Bleeding.
Yep. And our office, we're open from 8 to 4, Monday through Thursday this week. So if they give a call and it's one of those things, we'll set up a time. And yes, we screen people before they come in.
Sure.
We're taking temperatures. We're wiping things down. There's more, the office is clean as, oh my gosh, everything is clean 2 and 3 and 4 times. So
I thought I saw you and the staff eating off the floor.
No,
not that clean. Okay.
It was clean enough too, but we're not going to do that. So, but this brings to the point of what can you do now? We're delaying your hygiene visits, your professional cleanings at the dental office. This makes the home care that you do at home right now extremely important. And there's a couple of reasons for that. Yes, you don't want to get any dental issues going on with this, but if your body is continuing to fight an oral infection, whether it be for the teeth or from the gums, that's working on your whole body's immune system. Your immune system is working on that. If we are exposed to different viruses, different things, our immune system needs to be 100% so we can fight it.
We can't have that compromise with anything that we're doing.
Absolutely. Right. So you've got to take thorough care of your teeth. And one thing you can't complain about now is time.
Right.
You probably have 5 to 10 minutes to spend one time a day thoroughly cleaning your teeth. Spend the time with the electric toothbrush or the manual in between the teeth with the floss or the water irrigation, the little brushes. Do whatever it takes. But now is critical. You've got to spend that time, not just for you, but the whole family. So spend that time. You've got it. So take advantage of it.
And we've often talked about what your kids are seeing. They're watching what you're doing. They're not just listening to you saying, go brush your teeth for, better than that. They're watching you. And this is
do as I say, not as I do.
Right.
Nah, it doesn't work. You need to do, and then the kids are going to watch it. But that's the critical thing that you can do right now. And that's available for everybody at home. You can do it right now. It's not going to cost you anything extra.
So, as we move out of the physical part of this a little bit, and we talk about the emotional side of what Corona is doing, and some opportunity, I don't want to say I was surprised by your less than negative attitude. You've lived long enough that you've seen stuff like this pass. I mean, we've never seen anything exactly like this, but you had some really encouraging words, and I think that goes right along with what we're talking about tonight.
We're not going to minimize how bad this is. There are some bad things about it. World War II was really bad. That was a bad thing. The men were sent off to war. The women stayed back here. There was food rationing, gas rationing. There was victory gardens that people had to grow their own vegetables. but we had a common enemy. It
Mhm.
was the Germans and the Japanese. That was the enemy. And everybody united against what was going on. That with the Korean War, there wasn't as much of a unification on that. And certainly we came along with the Vietnam War. That was divisive in this
Yeah.
country. Well, this is the first time that I can think of since World War II that we have had a united front against a common enemy.
Mhm.
The enemy is unseen. The enemy is a virus. But what's happened is, thank goodness to the leadership that we have in Washington and some of the recommendations that they've made, we've got the private sector working with the public sector, working together.
Mhm.
We've got competitors working together.
Mhm.
We've got so many people working together against a common enemy. There's a silver lining here, and I'm not minimizing things, so please
Right.
don't. But there is a huge silver lining. There's going to be more innovations just because of this. There are online learning school things for the kids where they've offered their services to the schools for free.
Mhm.
Let's see if we
More
can
giving.
more
Mhm.
giving.
Yeah.
There's a lot of positive things that have come out for this. We can focus on whatever we want, and yes, we still have to be careful. Yes, we want to keep a distance. Yes, we want to wash our hands often.
Mhm.
Those are things, but there is some good that's going to come out of this once we get through this part. We
Mhm.
may look back in 6 months or a year and say, wow, that was something we went through, but look what we have now.
Mhm.
And they're fast tracking so many of these different medications. Is that good or is it that bad? Well, it depends if you're the one that needs it or not.
Right.
You
Right.
know,
Wow.
are there
Yeah.
going to be consequences? Everything we do has consequences.
Right.
Some consequences are good, some consequences are other than good.
Mhm.
But everything we do is going to have some consequences. I think there's going to be a lot of good consequences just because of what's happening and how we as a whole are handling it.
Mm.
There are individuals that are, you know, I can't say that I would have been a spring breaker going to the beach like they did on that,
Right.
but that's
Right.
over. So let's move forward on this stuff.
Right.
So in addition to the bad stuff, let's at least recognize there's some good stuff happening.
Mhm. I think about your daughter who's on the front line in the medical industry, and you had shared a story. I'd love for you, if you're comfortable with that, sharing about it.
Yeah, she works with people in the hospital that are not expected to make it. And what's happening in with the coronavirus is that they can't have any visitors. You got to be, so people can't be with them. And she sat with a gentleman last week for an hour and a half as he passed away, and she was the only one with him.
Mhm.
So it's nice to have people that they're trying to make the exit as peaceful as
Mhm.
it can be.
Mhm.
Nobody gets out alive. I don't care what color you are. I don't care man or woman. I don't care where you come from. Nobody gets out alive. And
Right.
we all have to agree with that. Now, let's try and hang around here as long as we can,
Right.
as long as we can be comfortable and
Right.
enjoy life.
Yeah.
But on the exit, it's kind of nice to have a if there is such thing as a good exit, because I think I've seen some pretty bad exits, and it's
Yeah.
nice to have a good one. So,
Yeah.
but the one thing that's happening in the hospital is the nursing home will bring someone in there that they are suspicious for the coronavirus, but they can't go back to the nursing home
Mm.
until they're proven that they don't have it or the 14-day quarantine. So you've got people in the hospital that are they're Alzheimer's, they're dementia, they're laying up there, they're in isolation.
Right.
This is not a good situation. So
Right.
I was talking about the good. I realize there's the bad, but
Of course.
we'll look back on this whole thing and say, well,
Mm.
are we better off for it or not? So,
Mm. I guess that comes down a lot to attitude too. You know,
man, isn't that it?
the time that we have now,
Isn't that
you
it?
had mentioned something about maybe this is the time to sit down those pictures that you were going to put in an album. That really struck a chord because I've got a huge chest full of photos that this would be a great time. It's kind of like it feels like the world's just been unplugged and we're going to get plugged back in. And what do you do with that time that we had?
Well, we need to make lemonade out of your lemons. Okay, someone hit the pause button, and that's
Yeah.
what it is. The pause button. It didn't rewind. It's just the
Right.
pause button. And life is going to get back to normal here. And at some point, it may be a month or two. It could be longer than that. Could be less than that. Who
Mhm.
knows? But in the meantime, let's be kind to each other.
Mhm. Mhm.
Let's do what we can do. It's so easy to focus on what we can't do.
Right.
but let's focus on what we can do. And there's
Yeah.
a ton of things we can do. That's going to make our lives better in the long run.
Absolutely.
Yeah.
If you've got any questions, please go on. We're live right now, or if you're watching this in a rerun, go ahead and ask a question. We're going to come back and revisit those. And if you ask a question and we use it in a future episode, man, you're going to get a Your Filthy Mouth mug. It's a coffee mug, and I wish I had one here. I meant to have one. So, but go ahead and ask a question. Let us know. And Dr. Chuck, I guess the main thing is if you're watching for the very first time and you're wondering, what is this dentist doing on talking about, it's Corona, he's talking. Well, we do this every week because Dr. Chuck is very passionate about a very special, important message that we've been talking about for years, and that is
Your filthy mouth. It's the
Mhm.
connection between the health of your mouth and how that affects the rest of your body.
Mhm.
What happens in Vegas may stay in Vegas, but what happens in your mouth goes through the rest of your body. I had a patient yesterday that we were talking about his dental health, and he hadn't had his teeth cleaned in years and years. And I started talking to him about, do you know the infections in your mouth don't stay in your mouth? That abscess you have on that tooth, that's sending pus that goes through your bloodstream and goes everywhere in your body, from your heart to your brain to your pancreas, everywhere. And he's like, really? No
Mhm.
one's ever told me that.
Mm.
I never had that idea.
Mm.
So once he learned the why behind why we want to do some of these things,
Mhm.
he was much more apt to go ahead and get things taken care of. But
Yeah.
nobody had ever told him that, you mean infections in my mouth can affect my heart or my brain? Yes.
Mhm.
And that's the whole thing. That's the purpose of yourfilthymouth.com is we have links that go to the research that shows you how much dental infections affect your heart, affect your brain, affect your pancreas, affect rheumatoid arthritis, affect pregnancy complications, affect Alzheimer's disease. So it's not just about your mouth, it's about the whole body.
Mhm.
And again, once people get it, it changes their behavior. And that's
Mhm.
kind of what we want. We want to say behavior change. Knowledge is not power, it's potential power. It only becomes power when we put it to work.
Mm.
And so this is what we want to have people do is like have a little light bulb go on and say, oh my gosh, now I get it.
Right.
Okay, I'm going to spend more time taking care of my teeth.
And I know that physicians are very busy right now, but could there be an opportunity for physicians and dentists to begin talking about, well, gosh, I have a patient who's on high blood pressure medicine. Could it possibly be something that's happening in the mouth? That needs to happen. This conversation needs to happen at some point.
Well, and what I'm asking my patients to do is the next time you see your physician, just ask your physician, is there any link between what happens in the mouth and the rest of the body? And just find out what their answer is. I'm not blaming physicians because they were not trained any of this in medical school. When I ask the physicians I've asked, how much training did you get about the mouth? Well, maybe a lecture, maybe a day. That was about it.
Wow.
Leave it to the dentist. The dentist have the mouth covered. Don't worry about it. Well, that would be true, except for the same blood that goes through dental infections picks up bacteria and brings it to the heart, brings it to the brain, brings it to the pancreas. So you can't isolate. It's we're all connected. So, but this is somewhere. And if you've got a physician, ask him, and maybe we can. That's a good starting point. If you've got a good dentist, get your dentist to talk with your physician. So it's not about me. It's not about us. It's about you. It's about your health. We don't want to have situations that can be completely avoided.
Yeah.
So
And just to wrap up, as a reminder, we're all in this together, aren't we?
absolutely,
Yeah.
we're all in the same boat.
Yeah.
So be safe. Wash your hands often, and love your family. Parents may get a chance to spend a little bit of extra time with their kids now. That could be both good and bad, but make it creative. Make lemonade out of your lemons.
Thank you for joining us. Take care.
Thank you.